Well, I'm O.P. Yadav. I'm the Chief Cardiac Surgeon and the Chief Executive Officer of the National Heart Institute in New Delhi. See, in the artery we have two kinds of conduits, arterial and venous. Typically the arterial conduits are the bilateral intermammary arteries, the radial arteries, the gastroepiploic artery and the inferior epigastric artery. And the veins we take from the leg are the long saphenous and the short saphenous and the cephalic vein from the hand. Whenever we do a bypass surgery where we use only arterial conduits and do not use venous conduit, that is what is called as total arterial myocardial revascularization. It can be performed using various configurations. We can use free grafts, we can use in situ grafts, we can use single grafts, or we can use what we call as sequential or jump grafts, in which one conduit can be used to bypass two arteries. For example, a RIMA can be used to do a side-to-side anastomosis to the diagonal and then an end-to-side anastomosis to the LAD, what is called a sequential graft. We can also take down a free graft and attach it to a pedicle graft and do T or Y configuration of total arterial revascularization, what are also called as the Y grafts or the T graft.